Yeah, a lot of folks don't realize the iliopsoas muscle is basically the largest muscle in the body. I'm going to use the hip joint. This is a hip joint. The iliopsoas muscle originates on the iliac crest and it goes in front of the hip joint. Now, Iliopsoas syndrome or Iliopsoas bursitis or Iliopsoas tendonitis basically means that the iliopsoas muscle, this huge muscle that flexes the hip joint, is irritated. It's irritated. It's in spasm. It's painful. When it makes a clicky sound or a cracking sound or a crunching sound, it's called snapping hip syndrome. And we have a great illustration showing that, so that's going to pop up. Now, the typical treatment of Iliopsoas syndrome is basically that you get physical therapy and you do stretching. But you'll see how the hip joint's right here, and this is the iliofemoral ligaments that support the hip. Well, in my experience as a prolotherapist, the long-term cause of Iliopsoas tendonitis, bursitis, and snapping hip syndrome is actually hip instability from either a labral tear or a ligament injury of the hip. In other words, if the hip joint is unstable and is moving too much, that's going to cause chronic spasm of the iliopsoas muscle. And anybody knows who's had a chronic muscle spasm, the muscle's going to get tight. Lactic acid builds up, it's painful, the muscle gets tight. You get a massage, you get physical therapy, you spend a lot of time, energy, money, and it doesn't go away. It doesn't go away because the iliopsoas muscle is trying to protect the front of the hip, because a person has a labral tear, a hip labral tear, or they have a ligament injury, the iliofemoral ligament, they injured it. So if you injure that, what's going to happen is there's going to be excessive movement of the hip. That can, of course, cause, beside terrible pain, it'll cause crunching, clicking, cracking. The athlete won't have power. They'll notice they can't run as far or as hard, and it's very, very disabling. So anyone who has that, they should get an assessment for prolotherapy, because prolotherapy to the ligaments, into the labrum, stimulates repair. We get great, great results. Resolving, not just helping, but resolving Iliopsoas tendonitis, Iliopsoas bursitis, Iliopsoas syndrome, snapping hip syndrome, hip instability, and labral tears, because all of those conditions have as the root cause hip instability. And the treatment for hip instability isn't massages, it's not iliopsoas stretches, it's stabilization of the hip by stimulating the ligaments to repair and the labrum to repair. And if an athlete does that, then normally the treatment's curative. Now, normally prolotherapy, it's 3, 4, 5 visits of prolotherapy, but often the prolotherapy is curative.